This presentation demonstrates the use of the maximal implantation potential or MIP point during in vitro fertilization to facilitate embryo transfer and improve pregnancy rates. The goal of the MIP point concept and technique is to imitate nature, using 3D and 4D ultrasound to locate the optimal target for successful embryo placement within the uterine cavity. The uterine cavity resembles an inverted triangle. The fallopian tubes open into the cavity, one in each of the upper regions of the triangle. In most pregnancies, the embryo implants in a specific area in the posterior wall of the uterus, where the endometrium is most receptive. This center point of this area is identified as the intersection of two imaginary lines, one originating in each fallopian tube within the triangle. This intersection is now being referred to as the maximal implantation potential or MIP point, which can only be visualized using three-dimensional ultrasound. The MIP point varies from patient to patient dependent upon the shape of the uterine cavity. Whether the cavity is normal or a variation of normal, using the MIP point technique enables finding this optimal target for embryo placement. Adding 4D ultrasound facilitates the accurate placement of the embryos at the MIP point. At the time of the procedure, the catheter is slowly inserted through the cervix and uterine cavity, with the embryos at the tip. Visual guidance is enabled using 3D and 4D ultrasound. When the tip of the catheter reaches the MIP point, the embryos are released, accompanied by a distinct flash visible on the ultrasound screen, and the catheter is withdrawn. In a second case, the catheter with the embryos are inserted. When the catheter tip reaches the MIP point, the embryos are released. A distinct flash is visible as the catheter is withdrawn. In the field of in vitro fertilization, the tendency today is to limit the number of embryos transferred, with the goal of single embryo transfer. This demands increased accuracy and precision in regard to embryo placement. The MIP point concept and technique, utilizing multidimensional ultrasound, enables the physician to locate the optimal target for successful placement. After more than 5,000 cases, the precise identification and guidance in targeting the MIP point has contributed to an unprecedented level of success with embryo transfer. Advances in imaging technology and placement technique are coming together to benefit one of the most important aspects of life, and that is the initiation of life itself.